You're welcome once again. In this video, I'm going to talk about evaluation station in OSCE as part of the APIE. So if you are preparing for your OSCE as a nurse or nursing associate, make sure you watch this video to the end, and don't forget to subscribe and also like, comment and share this video to as many as you can. Once again, you're welcome. My name is Gentle. So in this video, I'm going to talk about how to go about your evaluation station in OSCE. Evaluation is the fourth element of the APIE. Remember, in the APIE, we have assessment, planning, implementation, and evaluation for adult nursing OSCE. And for nursing associate, we have assessment, implementation, and then the evaluation. There's just slight differences when it comes to the nursing associate, but the flow remains the same. You're going to use 8 minutes to verbally hand over the care of your patient from assessment to implementation using the document you have. And in evaluation station, you'll be given this page of a document which contains the current situation of the patient, including the most recent vital observations of the patient that will aid you in your evaluation or your nursing handover when it comes to the APIE in OSCE. During your 8 minutes evaluation, the scene safety provide privacy doesn't work in here. You're not going to do any of these stuff. You're going to hand over the care of your patient using the SBAR format, where S is what? Situation, B, background, A, assessment, and R for recommendation. I have a way of arranging the document in order to suit the SBAR format. So by the time you read all these pages of the document, you have completed the SBAR or your handover in OSCE. What we do is that we organize face-to-face training for people who are preparing for their OSCE. So if you're interested, send me a DM and then we'll take it from there. So I'm going to spend the next 8 minutes to do the evaluation for you to see how it goes so that you can practice accordingly. My name is Peter, one of the nurses working on this Nightingale Ward Acute Medical Unit. And I'm here today, 1800 hours, to hand over the care of Alice Humphrey. And reason for handover is for continuity of care. Alice Humphrey's date of birth 1101-1950 was admitted yesterday with hospital number D215674. Address 138 Biddle Avenue, Westcliff-on-Sea. Alice presented with shortness of breath, wheezing. He has got rapid breathing at times, having chest tightness, complaints of feeling like a band is tightening around the chest, has occasional chest pain and palpitation. He's having severe and constant cough, which worsens at night and early in the morning. He's having trouble sleeping due to coughing and breathlessness, struggling to do activities of daily living due to breathing difficulties, diagnosed as having unstable asthma. Alice has past medical history of asthma, rheumatoid arthritis, bronchiolitis in childhood, and then hay fever. His social histories are he's independent with activities of daily living. He lives with his wife in a bungalow. He's a non-smoker currently. He has stopped smoking 2 years ago. Drink 2 to 4 pints of lager a week, usually on weekend. He had drug history of cocodamol 3500, 2 tablets 3 times daily, salbutamol inhaler, aspirin, and beclometasone inhaler twice a day. Allergies. Alice is allergic to penicillin, which causes anaphylaxis and then wheeze. Earlier on this morning, around 800 hours, I performed a 2-year assessment on Alice, and these were his assessment observations. He was having a respiratory rate of 26 breaths per cycle, oxygen saturation rate of 99%. Alice was on air with blood pressure of 115/75. Pulse rate was 78 beats per minute. Alice was alert with temperature of 36.8. His news total was 3, so I was monitoring him every hourly, and I also escalated his care. Currently, Alice is having this set of vital observations. As compared to the previous one did earlier, Alice's current temperature is 36.6, which I saw a slight decrease from the previous was 36.8. His current pulse is 90 beats per minute, which is also a very drastic increase from the previous one of 78 beats per minute to 90. His respiratory rate has come to the normal range of 19 breaths per minute from the previous of 26 breaths per minute. So that one is a good one there. Oxygen saturation has also decreased by 1% from 99% to 98%. Blood pressure systolic has increased from 115 previously to 150 now. So please keep an eye on the blood pressure and then escalate to the doctors accordingly. News total is now 0, but continue to monitor alerts according to the current news score and then escalate if there is any other concerns. After my assessment around 1100 hours, I developed 2 nursing care plans for alerts based on some problems that I identified. The first problem was that alerts is short of breath due to unstable asthma with a respiratory rate of 26 breaths per minute. So what I did was to explain to Alex his plan of care and gain his consent. I also monitored and recorded Alex's observations every hourly and then escalated to the doctors accordingly. I assessed Alex's breathing pattern, reading and depth every hourly, and also assisted Alex to assume an upright position to promote lung expansion. I taught Alex how to do deep breathing exercises and referred him to the respiratory nurse specialist. I also encouraged Alex how to use the core bell when breathing worsens and documented all care. The second problem noticed is that Alex is having activity intolerance due to breathlessness secondary to unstable asthma. So just as I did earlier, I explained to Alex his plan of care and gained consent, monitored and recorded his observations every hourly and escalated accordingly. I assessed the need for one-to-one assistance and supervision every 12 hourly, evaluated Alex's level of activities every 12 hourly, and also offered rest periods between activities for Alex. I also kept necessary items closer to Alex for easy reach out, and I referred Alex to the physiotherapist for further mobility assessment. I gave him callback to press if he need any assistance, and then documented all Alex care. So around 1200 hours this afternoon, Alex was due for his medication, so I administered this medication. Just as I read earlier, Alex is allergic to penicillin, so there were some medications I did not give. So I gave clarithromycin 500 mg. I also administered prednisolone 30 mg per hour, and amlodipine, his blood pressure tablet, 5 mg. Alex was due for flucloxacillin, and because he's allergic to penicillin and flucloxacillin also contains penicillin, I wasn't happy to give the flucloxacillin. So please make sure you escalate it to the medical team so that they give a suitable antibiotic in place of the flucloxacillin. And then I also didn't administer his ibuprofen because according to his record, he's an asthmatic patient and ibuprofen is contraindicated in asthma, so I didn't give that one as well. Salbutamol was also prescribed, but when I was checking the medication record, I found out that there is no prescriber signature and blip number for the prescription, so I wasn't happy to administer the salbutamol as well. On the as required side, there was paracetamol, and then Alex needed it, so I administered paracetamol 1 gram to Alex and then documented accordingly. So just as I said, I did not give the salbutamol, penicillin, and then flucloxacillin and then ibuprofen due to their respective reason, as I stated earlier. Make sure you escalate this to the medical team so that they'll review the medication errors in the medication chart. Do you have any concerns? All right, so I recommend that you continue to monitor Alex according to the current news score, and also follow up with the referrals I made in the care plan as well. And also make sure you don't give any penicillin containing medication to Alex since he's allergic to penicillin. And also Alex prefer only female carers to work on him, so make sure you escalate it to the team so that they will be aware of that. But in case of anything clinically, you can escalate to the medical team so that they can work on that. And don't forget to follow up with the referrals. Make sure you monitor him according to the current unit score, and also the medication errors, escalate for it to be intervened accordingly. Thank you. So basically, you spend 8 minutes reading your documents, but you need to learn how to arrange the your document in order to fit the SBAR format. This and many more are what we do when you come to our face-to-face training. We guide you systematically to go through the process to go and pass your OSCE. Make sure you share this video to anyone preparing for their OSCE. Once again, my name is Gentle. What I do is I talk about OSCE and other processes when it comes to the registration on the NMC portal to become a nurse, midwife, or nurse associate here in the UK. Don't forget to subscribe. Bye.